show you an exercise that's about to help you to relax your lower back, feel movement of your pelvis. The goal here is that you're feeling awareness that the movement of bending over or straightening back up always starts at the pelvis. It's not the back. We're not trying to tighten your back. We're actually trying to say back, you've done enough already. We're gonna do what we're supposed to do because we're gonna use our butt, okay? So it's not gonna be hard work. It's supposed to be thoughtful work, and it's supposed to be at the pelvic level. So when I talk pelvis, we're talking about right here, that big bowl right here, okay? So now we kind of start with this one, learning what an anterior and posterior pelvic tilt is. Now, if you don't know that, there's another video that I will give to you, or it's on the web page. Find it and start with that. But what it should start to look like is your feet firmly on the floor. Feel that floor. If you're dangling or you're up like this, you're too high, this is not going to work. Make sure the back of the chair is nowhere near your back. You need to have space. We're going to try to learn to bend over freely and without pain and without using your back. That's the goal. So think about that as you're doing this. I'll walk you through it. So you're going to breathe in. That's the anterior tilt. So I'm trying to overemphasize my back is arching there. I'm not working hard to do that, but there is a little bit of tightness in your lower back because the muscles in the back contract you to do that in a small, low level. Now we're going to say, okay, that was your job. Now you get to go off. So that anterior tilt then turns into the exhale posterior tilt, okay? So that is the beginning of this exercise. You need to be able to feel that bum curling under, that belly button squishing back, feeling relaxed with your lower back. So you're breathing in, and make sure I feel my feet. I breathe out, I let it fall. Now if I stay there, I keep my weight technically in my butt. From there, I bend over, okay? I keep my back rounding. So I'm gonna get my hands out of the way so you can see that. My back stays rounded, okay? When I get there, I could come right back up, which is fine, or I can add in a pull of the ankles. I'm gonna add in a pull. I grab my ankles and I pull gently up on my ankles. What that does is it turns on my lower back muscles. They say, okay, lower back, that's you, but now shut off because I don't need you anymore. Now what's happening is the weight of my bum stays heavy into the bed and I round back up. I don't straighten my back and come back up. That's my lower back muscle, or my lower back muscles. It's not my bum. So I'm going to show that to you again. I breathe in, my belly's relaxed, my back tightens a tiny little bit. I breathe out, my back rounds, my bum curls under, my belly button goes back. From there, I keep that belly button back. I keep my weight in my bum, and I round forward. I get to the bottom, I pull up on my ankles, I let that go with the breath. I feel the weight in my bum. I feel the weight pushing into my feet. My back never came on. I get to the top and I breathe in and I arch. Nice big breath. I breathe out, I let it fall, I round. I feel my body going forward. I want to put my hands on my thighs. I'll do that, that's great. If I don't want to do the lift up this time, I don't have to. I keep my weight in my bum. I keep my feet feeling like they're pushing into the floor. That's engaging my glutes. And then I go back. So it's all about feeling that roundiness of the back, the weight in the bum, the back's not off. There may be, in addition to this, if you're having a hard time kind of bending over and standing, I may add in this part, which is the standing up while you're sitting down. So it's the arch, it's the round, my weight's in my butt, my belly button's back, I come down. Instead of lifting up my ankles, I might stand up. From there, I think about the weight in my bum, and I pull it up and I push down with my feet. It's exactly the same activation, only I'm in standing. So it's changing it if you have a hard time with standing. And so then I would sit back down, my back nice and easy, and then I would repeat that. And it gives you a little more sense if you're having a hard time bending over when you're in standing. It makes it feel less scary.